In the age of diagnosis, neurologist Suzanne O'Sullivan offers a sharp and empathetic look at how contemporary medicine's fixation on diagnostic labels may be unintentionally distorting our understanding of health and normality. Her perspective is shaped by decades of first-hand experience with patients whose lives have been both clarified and complicated by the diagnoses they receive. The central concern is that, in our search for certainty and explanation, we may be medicalizing emotional pain, quirks of personality, or even natural developmental differences. O'Sullivan begins by charting the historical evolution of diagnosis in medicine, from the early categorization of diseases to the complex, symptom-based taxonomies we use today. She argues that while advances in imaging, genetics, and data analytics have allowed clinicians to identify more conditions than ever before, this progress has not always translated into better outcomes or happier patients. Instead, the abundance of new diagnostic possibilities may be feeding a cultural desire to label every discomfort, every deviation, as a medical problem. Through stories from her neurology practice, O'Sullivan humanizes the impact of labels. She shares how patients often feel relieved to receive a name for their suffering. It can validate experiences that others have dismissed or misunderstood. But she also presents the darker side. Once labeled, patients can feel limited by that identity, experiencing their every thought, feeling, or action through the lens of a medical condition. In some cases, the diagnosis becomes not a path to healing but a cage. She delves into complex and often controversial conditions like autism, ADHD, Lyme disease, and long COVID. These are areas where patient advocacy, scientific research, and popular discourse intersect, sometimes contentiously. O'Sullivan doesn't question the reality of suffering, but she questions whether every cluster of symptoms must be interpreted through a diagnostic framework. The danger, she warns, is that we begin to collapse human variety into a narrow medical script. A recurring theme is the fine line between attentive medicine and overreach. O'Sullivan reflects on how diagnostic enthusiasm can lead to overtesting, overtreatment, and misdiagnosis, problems that not only waste resources but also expose patients to physical and psychological harm. The push to name everything can unintentionally medicalize childhood behavior, ordinary grief, or age-related change. The pharmaceutical industry receives particular scrutiny. O'Sullivan points out how drug companies have helped shape public and professional understanding of certain conditions, sometimes emphasizing medication as a first-line solution. While she acknowledges that pharmaceuticals can be life-saving, she questions the commercial dynamics that influence how diagnoses are defined, publicized, and treated. In one chapter, O'Sullivan explores the psychological weight of diagnosis. She explains how a label can alter how people see themselves, sometimes fostering helplessness or dependency. Some patients come to identify so closely with their diagnosis that it becomes a central part of their identity, something that gives shape to their suffering but also limits their sense of agency or potential for change. Her critique is not anti-medicine but anti-reductionism. O'Sullivan urges practitioners to go beyond checklists and diagnostic manuals, and instead take the time to listen to the full story behind a patient's symptoms. She describes cases where careful conversation, rather than invasive testing, revealed the real sources of distress, bereavement, trauma, isolation, or cultural disconnection. Throughout the book, O'Sullivan makes a case for a more human-centered approach to medical care. This includes not only relational listening, but also a commitment to acknowledging complexity without needing to reduce it to a single cause or label. She envisions a kind of medicine that can tolerate uncertainty and resist the seduction of false precision. She also speaks directly to the public, cautioning against the rise of self-diagnosis through social media and symptom search engines. While digital access to information can empower patients, it can also overwhelm them, especially when the nuances of medical science are reduced to hashtags or simplified narratives. The book calls for both patients and professionals to reclaim curiosity and context in the diagnostic process. In later chapters, O'Sullivan reflects on the social forces that shape what we consider pathological. Cultural norms, media narratives, and systemic inequalities all influence who gets diagnosed and how. She shows how women, children, neurodivergent people, and marginalized communities are particularly vulnerable to being labeled in ways that can pathologize their identities rather than support their well-being. She presents alternative models of care that prioritize function and quality of life over classification. These include multidisciplinary teams, community-based mental health support, and programs that prioritize lived experience over clinical jargon. Her examples offer hope and show that it's possible to care deeply for people without needing to name them into boxes. The stories O'Sullivan shares are intimate, often heartbreaking, but never sensationalized. Whether it's a child diagnosed with autism after years of misinterpretation, or a woman struggling with chronic fatigue who feels invalidated by every doctor she sees, the common thread is the need for empathy, humility, and open-mindedness in medicine. These portraits stay with the reader, haunting and instructing long after the chapter ends. In her closing arguments, O'Sullivan poses a question that lingers: what would it mean to live in a world where we accepted more ambiguity in our bodies and minds? She doesn't suggest abandoning diagnosis entirely, but she asks us to imagine a more spacious understanding of health, one that allows for difference, fluctuation, and unpredictability. This, she argues, is where true care begins. The age of diagnosis ultimately argues for a future of medicine that is both smarter and softer, one that pairs scientific rigor with human nuance. Suzanne O'Sullivan invites us to recognize the power of names, but also their limits, reminding us that the stories we tell about illness can either liberate or confine. Her message is clear: in order to truly help, we must first learn to see.